The clock is ticking for the 22 million Americans currently enrolled in the Affordable Care Act as lawmakers remain divided over extending those ACA tax subsidies. As the White House floats the idea of an extension, nothing's on the table yet. A vote is expected in the Senate next month to determine if enrollees will continue to see tax credits at lower monthly premiums. If those go away, that monthly expense skyrockets and could mean people have to drop ACA coverage completely. I spoke with a local direct care provider about the option of joining a health share program, whether it's because you need an alternative to ACA or you just find big box plans too costly. Health share members agree to share medical expenses and contribute to a pool that goes to cover medical bills. Plans will vary widely depending on your medical needs. Dr. Arthi Thongadu, a Houston-based endocrinologist who hosts the podcast Endocrine Matters, says there are definite pros and cons to these plans based on your specific medical needs. Should you know what you might be needing down the line before you choose to go this route, because they don't cover everything that traditional big box insurance companies might cover?
Yeah, so these work best for people who are relatively healthy. If you have chronic medical problems that you know that you're going to frequently have to go to the hospital for any sort of reason, probably not the best fit. But if you're noticing that you're paying too much, or if you are self-employed, you're a business owner, and you're paying for your own health care and your family's health care, and everybody is relatively healthy, then I think a cost share would be something to seriously consider.
And as folks might fall off of ACA because they can't afford what's coming at them first of the year, that's something that I imagine you would recommend folks look at as well.
Yeah, and I think, I speak to several brokers, and a lot of them are actually, that's their first thing to recommend to people who are falling off the ACA. You could be very financially stable based on the numbers, but still not be able to afford an additional $24,000, $30,000 a year. That's just a lot of money for most people. So I think that if we can reduce that, we can at least get people catastrophic coverage so they're not scared to go to the hospital if they are having an emergency in the middle of the night.
December 15th is the deadline for Americans to sign up for or change a plan. That begins coverage January 1st. If you'd like more info on cost sharing plans, Dr. Thongadu talks about the different options on her website. She also has videos up on how to lower prescription med costs and negotiating medical bills on her YouTube channel. You'll find links to all of that in this article on clicktohouston.com.